So,
Yes.
so welcome everybody to our quarterly area-wide meeting today, January 27th, the last Friday of the month, which is really hard to believe because it seemed like Christmas was last week. So we're going to get started first by kind of jumping in. We need to approve the minutes from July 29th as well as October 28th. So let's first start with the July minutes. Hopefully everybody had a chance to look at them and review them. When you respond to additions, corrections, motions, whatever, make sure you say your name so that Courtney can kind of keep track of us all. It's kind of hard to do on Zoom. We don't see everybody's faces totally. So let's backtrack and look at the minutes from July 29th. Hopefully everybody had a chance to look at it. Any additions anybody would like to make? Any corrections at all? Okay, so I move to approve the minutes from July 29th.
It's Mary Shelton.
So moved, Jeannie.
I second that motion.
Great, thank you. So let's look at October 28th, minutes from October 28th. As we reviewed them, are there any additions to the minutes? Any corrections at all that need to be made to the minutes? So would we like to approve the minutes from October 28th, please?
Casey Carr,
Mary
I make a
Shelton.
motion to approve.
Perfect. Thank
Mary
you.
Shelton, I second that motion.
Great, thank you very much. Now we'll move down a little bit to our old business. Any old business that we have? Okay, let's move into our county updates here. So we'll do the usual alphabetical order. Portage County, have any updates for us?
I don't think Melissa Long has called in yet, so if anyone else is on from Portage County that has anything to add, feel free to jump in.
We can also circle back. Why don't we do that? We'll circle back to Portage County. How about Stark County? Anybody on from Stark that would like to share what's happening?
Yes, hi, this is Dan. Last year, I kind of reported on what was going on with the senior centers in Stark County, of which there are 4 remaining. And I did encounter a new activity in North Canton, which formerly had a senior center and it was closed. But late last year, and Courtney was involved in this too. I know she and some other staff members worked with the North Canton Public Library and the city of North Canton. And there's basically what I view as a really good solution to the problem with senior centers. The big advantage for senior centers is, of course, the socialization that can occur, and the learning and the activities and strength and fitness and so on. And the public library partnered with the city and has sessions a couple of times a week for the half a day or so at the North Canton Civic Center. They've staffed it, the library has staffed it, the city provides the space, they got grants to provide the materials, and they do a variety of activities without having to build a complete infrastructure of a senior center. And I talked to some of the participants. They love it. They love the person who is running it. Courtney, you may be more in touch with them than I am, because it was a couple of months ago that I went there and interviewed the person who's running it and some of the participants. But I don't know, Courtney, if you have any update on that.
Are you talking about Sam?
Yeah.
Yeah, so she's newer in her position. We met with her, it must have been roughly a year ago now, and she's really engaged and excited about some of the programming that she wants to roll out there. Direction Home is partnering with them to host a Taiji Chuan Moving for Better Balance health and wellness workshop. It's actually starting next week, February 7th. So I am co-leading that with Lori Smith from our agency, and that'll run through May. So we're really excited to get in there and start working with them on some different programming.
I really complimented them on creating this new model. More than half the senior centers in the county closed because they just weren't fiscally sustainable. And this is, and it does what senior centers should be doing. So I mean, I even encouraged them like to do a presentation at either a library conference or aging conference or whatever. It's just a great idea. The only other thing I have is I've been working with the resident council at McKinley, where I'm a volunteer ombudsman. And the president of that council had a very good run. He got a lot of good things done. And as he's going off his office, he wanted to achieve one more thing, which to raise the personal needs allowance of nursing home residents. And I helped him with some research, and we found out exactly who is responsible for that. It's the state legislature who has control over the size of the personal needs allowance of nursing home residents. And the federal government says it has to be between $30 and $200 a month. In Ohio, it's $50. So we collaborated on a letter, sent it to the newly elected or re-elected state representative and state senator. So, we're waiting for response and strategizing for the next step, and hope maybe to extend it to other facilities that can join in this appeal to raise the personal needs allowance. That's it.
Thanks, Dan.
Great
Lori, do you
stuff.
mind if I add a little bit?
Please do.
So just to let folks know that I was able to talk to Susan Sigmund, and Dan, I apologize for not getting with you. We have to set up our regularly occurring meetings again for 2023, but there is a group of interested parties in Stark County that have been able to move forward the age-friendly Stark initiative. And I'm very pleased to announce that they are closing in on obtaining the necessary funding to get the needs assessment completed for the first part of that project. So first step was to get the elected officials to okay the process. So the commissioners did vote and move forward so that Stark County did apply for and receive age-friendly designation as the starting of the 5-year process. Next step is to do a needs assessment to get community data to act on. And we were looking for roughly $15,000 to complete that. And I know that they were able to approach both the Stark Community Foundation as well as the Altman Foundation, I believe. I'll get the right stuff for the minutes, the right two folks for the minutes, and now are applying with Sisters of Charity in Canton to round out the rest of those funds. So really good news on the progress there, and I will keep folks updated as I hear more, but we are already all set up to start that needs assessment with the Center for Community Solutions when we get the funding locked in. So we're really excited about that.
It's Crystal with the RSVP program for Portage and Stark. I had 2 follow-up. First, Matt, that's great to hear. And honestly, if I could be any help in securing those responses from the community buy-in, please let whoever's on the council or the committee know. I'm happy to help where I can with that. And then Dan, are you able to share Sam's information? My program is a volunteer engagement program for folks 55 and older. And so I'm constantly looking for places to get in front of those folks who may want to volunteer. And it sounds like this new audience might be a great lane to do so. So if you could possibly either in the minutes share Sam's information or let us know a way to contact her and see where we can partner as well. I would love to do that.
I'll send that to Courtney to put in the minutes. It's a public program, so should be okay. Is that okay with you, Courtney? Great.
That'd be great. Thank you so much.
Okay, will do.
Great stuff, Dan, moving and shaking in Stark County. That's awesome. Really cool. And I'm really excited about the age friendly down there too. That's a really neat thing. Okay, let's move on to Summit County. Any reports from Summit?
Yes, I do, actually. I'm sure that perhaps Matt will be able to expand on these, and I know Lisa Mansfield will too. I have some news press releases. The Summit County was recognized as a dementia-friendly community. They worked with the county and the city of Akron, was led by the Summit County, I think the Akron Summit County Library, to get this this recognition. And a lot of businesses and local organizations were involved in it and putting the plan together. So that's really kind of exciting, actually. You know, dementia is a real problem, not only for the individuals that are dealing with it, but their caregivers too. So this is a support program to help them. So I think that's just wonderful. There also was a and that was released in January, I think, isn't that right? Matt, do you have anything to add on that, Matt?
I do. Barb is with us today, and Barb
good.
White newly retired from the Summit County Library, has been a force of nature behind this initiative. And I just can't say enough about her passion around this and dedication. And we have our first kind of committee meeting, I think, next week. And so I don't know, Barb, if you wanted to add anything regarding the dementia, Summit County Dementia Friends designation or not, but I'm sure excited about it.
Sure. As usual, you've exaggerated my role in this, but yeah, we had an organizational meeting. We're having our first sort of real meat and potatoes meeting on February 6th, and we'll be putting together the action plan, forming the evaluation team. Much like Age Friendly, there are steps in the process, and so that'll take care of a couple of the initial steps, and we'll get a timeline in place. And there's a lot of work to do in reducing the stigma around dementia and ensuring that that Summit County is welcoming and engaging for folks living with dementia and their care partners. But we've got great people on the task, and I'm looking forward to how things develop. So thanks for the mention.
Thank you, Barb. Also, there was a news release that the county and the city and Direction Home announced that the World Health Organization and AARP had approved the age-friendly strategic plan that was submitted. And it didn't take them very long either. It was a lot of work went into this. And that's exciting because, you know, the demographics and so forth, like AARP estimates that by 2040, 1 in every 5 people in the United States will be 65 years and older. That's incredible. So I think governments are truly looking at ways to make life comfortable and healthy for our senior population. And I'm really excited about that. Do you want to add anything to that, Matt?
No, just that that was the final step in the process. And so we have kind of increased momentum and didn't really wait for that kind of final blessing from World Health Organization and AARP, because we had already had the preliminary approval to move everything forward. And we were really pleased with the plan, and the plan has already kind of been vetted through the mayor's office in Akron and the executive's office in Summit County, as well as the respective councils. So we were really comfortable in moving things forward. And we have our committee meetings are really set, our implementation meetings around age friendly are set to meet in the coming weeks to really roll up sleeves and start diving into 2023 and put some actionable stuff together. So we're excited about that too.
Thank you. And Courtney shared with me that the Getting Wiser magazine is in the process. Is that right, Courtney?
Yep, our Getting Wiser magazine is in its final draft stages now. So hopefully that will be going out within the next couple of weeks for Summit County residents. And I think it turned out really good. We got some good content from different organizations in the county and pictures and a delicious recipe from Asia Inc. So that's definitely something to look out for as we move forward with it.
Thank you. Yeah, I'll look forward to that. And Lisa, are you on here? Because I was going to ask if you want to say anything about the Senior Expo. Senior Summit Expo for 2023. Because she got tied up. And I spoke with her about it. And is that going to be in May again? Because that was the,
Yes.
May is the
Yes, it's
recognized Senior Older Americans Month.
May
Is that right?
19th.
May 19th. Okay.
Yep, it's St.
Okay.
George's again. It's not the
Oh, it is the-
expo, but the summit. Expo is
The su-
every other year and the summit
That's right.
is every year. So, yep, May 19th, great lineup on, the focus is sort of reframing aging. So it's going to have a great focus this year and great lineup of speakers. Lisa can speak to it in more detail, but it is May 19th. Oh, Lisa's here. She said, I'm here.
Yep, she is here. She is here.
Can you guys hear me?
Yep,
Okay,
I can.
sorry. I wasn't coming through before, so I was like, wait. I'm here. Yes, thanks, Barb. It is definitely just a conference year, so I know that gets confusing every time we do this. It's like, oh, I almost wish we did it every year. Maybe we can make that happen somehow, because it's so confusing to folks. But it is a conference year. CEUs, CLEs, working hard with Lori Smith. Man, she's a treasure. You guys are so lucky. And also with the Akron Bar Association for CLEs, hoping to get those nursing home administrator credits as well this year. So watch your inbox for early registration information to go out next week to go ahead and register for those. We have Paul Greenwood coming in from California. He is an expert and a leading voice across the country in adult protective services. We're partnering with Summit County Prosecutor's Office. They're going to have him in on Thursday all day to meet with law enforcement, and then on Friday for us for the Senior Summit that morning. Also a panel including our Judge Stormer, as well as the prosecutor, the sheriff's office, and adult protective services to talk about what do those national initiatives look like on the local level. So real excited about that. Matt is going to be on talking about positive aging campaign that's coming out of the Age Friendly initiative. So many things in the afternoon, including mental health, LGBTQ seniors, as well as veterans. So it's going to run a lot of the gambit, as well as we are going to cover with Barb White and some folks from the state on dementia friendly and what that means to have that endorsement from Age Friendly, or dementia friendly. So really excited. More details next week. Watch that inbox.
Thank you, Lisa. That winds up my report.
I'm just going to add that Paul Greenwood is one of the most dynamic speakers and one of the most passionate people around the country. He has spoken here in Summit County in the past several times, as well as statewide conferences. We've had him at statewide. Down to earth, passionate guy. He was a prosecutor and actually started the elder abuse unit in the prosecutor's office out in San Diego. So he was very instrumental in doing what he did. And passion continues, even though he's not really working full time anymore. So if you can get there for that conference or part of it, make sure you for sure catch Paul, because he's awesome. The only other thing I want to add, Jeannie, in Summit County, and it kind of relates to the folks here in the meeting is that Tough Stuff, which is a group that's been around since 1983, has started up and running again. It's a very informal group. If anybody is interested, let me know. It's what someone calls a big think tank of professionals that meet informally once a month. And basically, we talk about tough stuff in the community, whether it be an individual tough case or it be a situation in the community. We had a lot of high-rise service coordinators that were there this past meeting in January. We haven't met for 3 years in person. So we finally are back in the swing of things. So if you're interested, I might, Courtney, shoot you the brochure that we have and you can add it to the minutes. Anybody's welcome. And there's no dues. The only thing we ask is you put a little donation in for hot chocolate or coffee if you have some. I'll get that to Courtney if anybody's interested in attending.
Thanks, Lori. That sounds
Yes.
really interesting.
Yeah, it's a good group.
Yes. Yes, Lori, Mary Shelton. And yes, I am interested. I remember Tough Stuff when it started many, many years ago. And it's just really encouraging to know that it's still active. Good.
Mary was probably one of the founding members,
Not a founding,
right?
but
Probably
in
the first
attendance, yes.
meeting.
Yes.
Yeah,
Yes.
yeah. It has been around for a long time. It's a great group. Okay, I'm going to circle back to Portage County. Jeannie, you all done? Anything else?
I'm
with Summit?
done.
Okay.
I'm done.
Circle back to Portage. Anybody on that wants to report Portage County update?
I serve Portage County also from my program in Portage and Stark. I just talked with the senior center in Portage, Ravenna last week, and they are working towards the farmers market program again this year. We've actually utilized my program, the volunteers, in partnership with the senior center. We've done delivery of vouchers in the last several years, but I think this year they asked for 700 vouchers for the farmers market for this summer, and that's just a lot to deliver. So we're in the talks of looking for better ways to serve our seniors. We used to be about 300, 350. So we've more than doubled over the last couple of years. More and more seniors need the help. I think with the changes coming down from SNAP services and other food restrictions and food needs in our economy, I think the needs are even higher with our seniors for services like that. So that's the only update I know of as of right now. I know our centers are busy. I know membership is up at the seniors center in Streetsboro. They have a new director as of about 1.5 years ago, Teresa Summer. She transferred from Ravenna to Streetsboro, and she's been able to increase their numbers. They now have a van, an activities van that is under the Parks and Rec that they can utilize for their lunch programs and stuff. And they have a lot going on. So check out their Facebook page. They have a lot of activities.
Thanks, Crystal. I think we have another caller. I know Mary Shelton has called in. There's another phone number that popped up. I'm wondering if that's Melissa.
If you're talking about Melissa Moore, no, I'm on Zoom on my laptop, so that's not my phone number.
Melissa Long. Melissa Long.
Yes, hello.
Hi, Melissa.
Hello there. Being this is my first meeting, I'm just making notes like crazy and listening to all the wonderful things that are being looked into and are happening, and I think it's great.
Welcome, Melissa.
Thank you.
Anything else with updates from the counties? Boy, everybody is busy, that's for sure. It's very cool. Okay.
I don't know if
Go ahead, Melissa.
I'm sorry. If Matt is still there, if he wants me to go into the project we're doing in Portage County, do you want me to say anything about that, Matt?
Yeah, I think we've got a couple minutes for just to kind of let the area-wide council know what's been going on out there.
Well, of course, it's winter, and we don't do much going around. But I have been working with the with the old county treasurer and the brand new county auditor, trying to put some figures together to find out what the cost of any type of levy that we would consider putting on would be for each household taxpayer. And I'm getting some help, but with a new auditor, it's going to take a little while. She doesn't quite know what she's doing, I don't think. So we got to give her a little bit of time. But the treasurer is working with me. He's been, Breadcrumb's been there for a while. And we'll get those figures. And once we get those figures, we have our program. And I think we can start going on around and talking to the county commissioners and seeing if we can't get a tax levy in the county for additional monies for senior programs and seniors health care. I don't know if you want to add anything to that, Matt, or not.
No, I think that was good. Thank you, Melissa, so much.
You're
Thanks,
welcome.
Melissa, for the update. We appreciate it.
Okay.
I do
Okay.
have
Go ahead.
one from Wayne. I think Ella might be on if she wanted to elaborate a little bit more on it, but
Thanks.
Ella's been doing wonderful work for us over in Wayne County as well, reaching out to churches and different faith communities. She's been reaching out to them with caregiver support information. Our family caregiver support specialist is trying to start a support group in Wayne County in person. So she gave her a couple of leads to follow up on with different churches. And then she's also, throughout the past few months, has been spreading the word on our health and wellness evidence-based programming, trying to get host sites and leaders in Wayne County too. So thank you, Ella, for doing that. And if you have anything else to add.
Yeah, I'd like to add something. I was trying to sell bingo size. Well, I have two problems. Two problems identified. Maybe other people can identify more problems. First, I've never attended bingo sites, so I can't give them firsthand information. But I do have all of the literature on my computer, and I send it to them by email. But here's the second problem. Many of the churches say they don't have the space for it. And then one church said, well, it was gambling and they don't do gambling. And I said, now I don't know if this is true, but this is what I told them. I told them this in good faith. I said, there's no money involved. I said, people just donate gifts that they give out for prizes. Now, is that true? I don't know if that's true, but that's what I told her.
Partially, we get the prizes through the program, so we can, with the grant money that we receive to host the program, we can purchase the prizes through that. So I know Lori has boxes upon boxes of stress balls and nutrition plates and all sorts of fun stuff, pedometers in the office. So we actually take care of all of that.
Well, then at least I told her it wasn't money, it was gifts, but that didn't help. So anyhow, I didn't have good luck with that. I'm having better luck with caregivers. But then I have one other thing I wanted to tell you. I belong to the St. Vincent de Paul Society in Worcester, and our organization received a letter last week from the Wayne Senior Network Services, and the office is in Lodi. Well, Lodi is not in Wayne County, so I thought that was strange. So I called the person to see what the deal is. I never heard of this Wayne Senior Network Services. Well, this is the best I could come up with. It's an organization of healthcare facilities like home health aid services and nursing homes, assisted living facilities and places like that. And they meet on a regular basis. And I told them I didn't care to join. They said they do have a representative from Direction Home that comes to the meeting. So I thought, well, that's covered, then I won't, I'm not concerned with that. But however, I am, I am the ombudsman for the county home, and I've been a Medicare, Medicaid surveyor. I know all about nursing homes, Medicare, Medicaid, and all that. but I didn't think that was an organization I wanted to join because it's all mostly people who are working today in these home health agencies, nursing homes, and assisted living. I didn't think I had anything to offer them. So that's it.
Thanks, Ella. Probably a good idea not to get involved with that group. I'm just kidding.
No, I think you're right on to it. Yes.
Yeah, you know what'll work and what's going to work for you, and I think you are aware of the fact that that's probably not a group, although probably a very good group, but just not going to fit what you need. Okay, thank you all for the updates. Matt, county report. Let's see, the state advocacy update, Matt.
Yep, I'm gonna have Courtney just give us a brief update on the roundtables that we had regarding the provider workforce shortage. I know that we had spoken about that at our last meeting and had a really good dialogue around the, I'm gonna just keep calling it a crisis because that's what it is, the crisis of the lack of direct care workforce, both in nursing homes and in home-based programs.
All right, yeah, we decided to do just a brief update for you all on as a follow-up to that conversation we had back in October, where we invited the legislators to our area-wide meeting and had some guest speakers and videos and things from members. But we wanted to keep it kind of at the front of your mind because it's also on the front of the mind of the state. And within Direction Home. So we are keeping these conversations going within Direction Home. We're still doing those efforts that we gave you the update on back in October with our provider workforce shortage task force that's internal and also working with our provider network. We showed a couple recorded member interviews at the last meeting. There are a couple more that we've done. We've talked with different members from all sorts of different situations that are just being drastically affected by their inability to find a home health care worker to a variety of reasons, whether it be location that they're in, among other things. We do have our form on our website to request more information about becoming a provider and being connected with our hiring provider network. We have now received, we're really excited about this. We've received over 100 requests now for more information about that. So we've been able to connect over 100 people with hiring providers in the area. And hopefully that's worked out in most cases at least. And again, that provider workforce group does continue to meet, and those provider network meetings between our staff and our providers have been reinstated. I believe the first one is on Tuesday. It's been, I'm not sure, but perhaps the first one since COVID started. So that's coming up with our providers as well. At the state level, this was an initiative that has been across the state. So all of the other AAAs in Ohio are conducting roundtables as well, just like we did back in October. I believe there's maybe one or two more that are concluding this week or next week throughout the state, and all of them have just found similar themes based on the discussions that they've had with their professionals, with their members, whatever guests they have at those roundtables, legislative or otherwise. The same needs are coming up, that they need rate increases, think the requirements are a little out of whack. Attendance has been pretty similar to our roundtable. Some of them have been picked up by local media. And there is kind of a social media network among the AAAs going on currently, trying to connect legislators and other AAAs to the issue. So there's a variety of hashtags out there that you might see. All of the AAAs are posting on their social media about the shortage. The state is posting. So if you see any of that, feel free to take a look, share it if you can. And just keep an eye on local media for more updates between now and our next meeting.
Thanks, Courtney. And I'll just keep going, and I'll be quick because I know we have our guest speaker today, and you hear me talk all the time. So I'll leave some opening for this. So as I usually do, I'll start at the federal level. Those of you who have an interest in politics or been watching the news know that it's been an interesting start to these sessions for both the federal and the Ohio legislatures. So it'll be interesting to see how they all hit the ground running with their work. Regarding our focus on federal advocacy, we have really kind of crossed the first level of what we need to get done through the FY 2023 appropriations. We've been hearing a lot about debt ceiling. Next slide, please. This is really what I wanted to highlight. This is from the our federal trade association, US Aging, formerly the National Association of Area Agencies. Their policy opportunities include these bullet points. I would want to point out the one highlighted in purple, the National Caregiving Strategy. This is near and dear to my heart. Those of you who have been serving on this advocacy council for a while know that I used to get to work in the caregiver support program here at Direction Home, and have watched caregiving through my personal life as well, and now get to participate in it. And I can tell you that there's no such thing as enough caregiver support out there. So the push for a national caregiving strategy is really a welcome one, and we will keep you updated on that. Next slide, please. The Older Americans Act is the law that brings area agencies on aging into existence, and it is the law that brings our Areawide Council into existence. It is set to expire at the end of the fiscal year 2024, which is September 30, 2024. As it is very important to us, we do start early in advocacy around the reauthorization of this bill. And so you'll start to hear rumblings of this maybe as early as our next meeting in April, but for sure in our July meeting, starting to talk about what we as an area-wide committee can do to help raise the voices of older adults towards this effort in DC. I will be attending the national day where all of the area agencies go to Capitol Hill and meet with our elected officials to bring these issues up and to light, and then we'll come home and tell you all about it. I believe I'll be there on the 26th and 27th, and I think our meeting is that following Friday. So I'll have an interesting report for you when I get back home. Next slide, please. So what's on the horizon as far as what we're concerned about with advocacy? And I think this will lead nicely into Dr. Ponder's messaging. But really, these are the items that we are keeping in front of our elected officials on the Hill. It includes COVID-19. You know, we still are dealing with the after effects of it. I don't even know if I can say after effects because it's still out there. And so it continues to be an issue. As Courtney mentioned, the workforce shortages are not just an Akron, Canton, or Ohio issue. This is a nationwide problem. As the COVID-19 federal funds ramp down, we are nervous about what that'll do to the support in the community and the aging network budgets that won't be as robust as they have been in the past few years to help more people. The Republican-led House will want leaner budgets typically, and the proposals to reduce safety net programs. We've seen that a little bit with the non-discretionary spending, non-defense discretionary spending that has come out through the government so far. And the divided Congress always kind of makes things a little bit more challenging to get policy moved, but we have high hopes. Next slide, please. And just to kind of reiterate, this is what we'll be talking to folks on the Hill about when we go in April. The Older Americans Act, caregivers as an issue, Medicaid home and community-based services. That is in Ohio, that's our Passport program, as well as the My Care Ohio program. And then also aligning social and healthcare models. And what that means is really looking at the whole person's experience as part of healthcare rather than just what happens in the doctor's office or what medicines they take. Things like, do they have enough food? Are they able to keep warm in the winter? Are they able to get to their doctor's appointments? Those all make up the social determinants of health that we really need to take a stronger look at, and that we as the Aging Network are really well positioned to help our medical communities achieve. I think Ohio is the next slide. Yep. So it's a budget year. And so in Ohio, we always like to do our advocacy early and often around the Ohio budget, making sure that our elected officials understand how important the work that the Aging Network does, and that Direction Home as an entity that pulls folks together and focuses work is really value added. We have a couple different priorities. One is to ensure equal access to home care for older adults and people with disabilities. This means that people should be able to access home care just as easily as nursing facilities. This has been an ongoing concern of ours since the inception of home and community-based care. We need to make sure that it's adequately available, not just in an enrollment, but also in a program side where we actually have the aids and the programs to put into the home to keep people safe and happy where they want to be. The MyCare Ohio demonstration is projected is going to be sunset soon in the next 18 months, I believe. I'm not quite sure, but we can get that date for you, the actual date. But we're already talking about what the next iteration of the duals program is going to be. Remember, duals is Medicare and Medicaid folks who need ongoing long-term services and supports. MyCare is going to transition into a special needs plan, we believe. And that's a whole other presentation that I'll save for another time, but we'll keep you updated on that as well as we get closer into the advocacy efforts for the budget in April. And then finally, my last slide just shows some of the additional priorities that the Ohio Association of Area Agencies is keeping in front of folks, including adult day services as an option. The other funding sources, the block grant is what we used to call it, which allows the area agencies access to more flexible funding to do programs. The assisted living waiver rate needs to be addressed, as well as the Ohio Housing Trust Fund. I see Tammy from our team on the screen, and she can tell you that there's just not enough affordable housing out there. And so we need to keep advocating for additional funds around Ohio Housing Trust Fund. And then finally, to increase spending for adult protective services up to a total of $9.72 million for the state. Even that doesn't sound like enough to me, but it sure is better than the 5.7 that we have now. And so we will be advocating for additional APS funding in the budget. And I'll pause here to see if there's any questions about what I went over. I know that that's a lot, but you'll be able to look at these slides at your leisure when we get the information out to you to review. And I will keep you updated via phone calls, frantic emails, letters, whenever we need you to start calling your elected officials and letting them know what's going on in the community. All right, in the interest of time, I'm going to move us to our guest speaker today. And I think, Courtney, you'll introduce Dr. Ponder for us.
Yep, we are so excited to have a guest speaker. I know it's been a while. We had the roundtable in October, but I think our meetings before that were heavily centered on allocations and area plan and the technical stuff. So we're happy to have something a little bit different today for you. Dr. Ponder was my professor back when I was at Kent State, and when I was a senior, we worked with different nonprofits in the community. Our project was with Asia Inc., and we, as a communications class, worked with them to create kind of like a communications outreach plan. So I kept that with me coming into this position and had a brainstorm about a year ago, I think, and have been working with him ever since to work with his class, his senior seminar this spring semester. So he's here today to talk a little bit about that class project, as well as any questions he might have for the experts on aging services and what's going on in the community, which is you all. And he, I'm sure, is ready for your questions as well.
Thank you, Courtney. Hi, I'm JD Ponder. So while that is my full name, I was named after both my grandparents, both my grandfathers. So I go by JD, just so everybody else knows along that line. So nice to meet you. I've been working at Kent State for a while. I don't want to say for how long. It's starting to get a little bit long in the tooth for all of those types of things. But one of the things that I do here is I tell my students that we are experts in communication, maybe not always on particular issues. And so we work with various nonprofit organizations, I do anyway, to help them either develop communication plans, execute communication plans, create content for the stuff that we do. Everything that Courtney and Matt have and everybody else has from Direction Home that is created in-house, we all know takes some time to do. And it takes a lot of energy and effort and thought and planning for that. And I happen to have at my disposal 16 undergraduate students who are trained in communication and communication areas. And so we are here to help you if you would like us to help get messaging out around the issues that you face on a daily basis. We were lucky enough to have Courtney come in and talk earlier this week to my class on Tuesday about what Direction Home does and the vision of Direction Home. Her and Matt have shared with us the brand Bible that helps guide us in terms of that. We talked about that on Thursday. We talked about, their eyes were about this big, I think, on Thursday after having talked with Courtney about the various things that they could be doing. And so Thursday for us was a lot of helping getting them narrowed down because they had a list we wrote on my whiteboard. Remember, some of you may remember chalkboards. We've evolved to whiteboards for at least in my school for a little bit, and that's a recent evolution. But we had on the list start off with somewhere around 50 different ideas that came out from that, and I'm like, and they felt very overwhelmed. So then we narrowed it down, and we've got about 25 ideas that we're kind of looking at helping craft messages to help share and to get people to think about aging and preparing for aging planning when it comes to that. So that's like the short version of kind of how I fit in here. So I'm going to be quiet for a little bit because that's something that I've learned is really, really good. and let you ask questions of me, and then I can go from there.
Can you give us some examples? This is Crystal Shanley. Can you give us some examples of those 25 narrowed down ideas that your class came up with?
Yeah, sure. That's a great question. So one of the things that we had heard routinely in Courtney and from talking with Matt too, is that Direction Home wants to be the front door to aging well and aging healthy. And so that was one of the things that they really narrowed in on this notion of creating messages, social media messages, print messages that live in this notion of a front door for information on aging and information on aging well and information on aging healthily. They also were interested in helping raise more awareness for Courtney. I don't know what you told them in terms of everything else, like after the fact, but they were really into the Taiji Chuan stuff, like a lot. So they're like, we want to do some stuff on that falls prevention health stuff because it sounds really fun. They were talking about bingo size as a way to get people to think about being familiar with your organization and then building that trust to seek out that information afterward. So we were looking at a lot of the programs that already exist within there, or the ideas that are already being done, but can we give you more materials and have them be adaptable to those situations, right? We oftentimes in my class talk about how just a piece of, I'm sorry, Courtney, for some flashbacks to other classes, but a piece of material that we create, if it's a digital piece, that can easily be transported into the print space, and we can use those materials over and over again. And then we talked about, in terms of that, to let everybody know, how to edit back materials, because oftentimes early people who are in the communication areas, like, we'll put everything you need to know on this piece of paper. And I'm like, no, that's not what people want. And that's definitely not what Direction Home wants. We want them to visit their website. We want them to continually push them to the place that we want them to do. And so we're in the early process of creating materials and conceptualizing materials. That's like next week, where we always push them back to your home site for that information, because that's how you know that we're actually having an impact on that when you see increased web traffic on your site. So those are the types of things that we're looking at right now.
JD, it's Barb White. Do you typically work with only one organization per semester, or do you have teams working with different groups?
That is a great question. One time I was ambitious and I learned a little bit from my ambition. And the most that I've worked with in terms of organizations for a semester was 12. That was a lot. That was a lot of different organizations that we worked with across different things. And I had plans for each one of my groups that we're working within there. But normally I try to narrow it down to 4 or 5, depending upon the size of the class. I try to keep them in groups of roughly 4-ish to engage in just conversation pieces across that. So that way it's more of a creative team. And then they're in charge of developing materials on their own outside of that. So they use the conversation, the creative team, as the sounding boards for these ideas, and then we break it down from there. But 4 or 5 is the max I go through now.
Hi, this is Dan. I'm wondering what techniques you have the students use to get the information they need from the organization to create the concepts, the materials, whatever. Do you use focus groups or surveys or just conversations? How does that work?
Yeah, so that depends upon the individual. Thank you for the question, Dan. That depends upon the individual types of materials we're looking for and how we do this. We always say that the gold standard for any type of messaging that you're creating are first-person narratives. So the stories of a person who lives through your services. They say, this is my story. Here's how I've interacted with Direction Home. Here's what they did for me. And those types of stories are the gold standard for whatever it is you're talking about. They are very difficult to get, though. In terms of my experience, in terms of other things, in terms of communication land, there's lots of press release, or there's releases we have to sign. We have to sign a media release. We have to sign a HIPAA release. We have to sign releases from my end just to cover my backside when it comes to my individual organization. So after a while, when someone sees so many releases, oftentimes they get kind of locked up, and that distracts from their storytelling in terms of that. So that's the gold standard. A very nice silver standard, I guess I would say. So in tier 2 are stories by people who work in the field. So they can use pseudonyms to talk about the people they've helped. They can use pseudonyms to say, hey, this is a type of person that I helped see this. This is what they were feeling. This is what they were experiencing. And here's why it matters so much. And when we see people tell stories, regardless of whatever it is that we're talking about, we, by and large, I can get a little nerdy with you, so I promise I'm doing my best to hold this back. Right. So when people are exposed to numbers and statistics and arguments and evidence by experts, by and large, if people are kind of on the fence, or if they're what we would call a hostile audience member, they engage in counter arguing. So they aren't listening to you anymore. They're just running through the arguments in their heads. But there's a large body of research that looks at the use of stories and narrative persuasion. And it says that narratives people can't discount. And a well-told story tends to stick with people longer, tends to bypass this argumentation process, tends to be more resistant to counter arguments. So all of these things exist in there. And our goal is to find ways to tell those stories. Now, to be honest with you, I don't have a preference if those stories occur in a focus group session or an interview session. In terms of data collection, those all have their places in terms of that. But in terms of actual acquiring the stories and modality of that doesn't matter to me. it's more of a question of how can we work with Direction Home, identify those community partners, find ways to make them comfortable, and then find ways to have them, if we're going to be doing this, talk through their stories so we can either, right, if you're talking visual messages, and if we get the gold standard of people telling their stories and we have all that stuff done, right, because that's a big wish list on there, then it's the question of how can we edit that stuff back? Can we, because if you have a good interview with somebody, doesn't matter if it's a focus group or a one-on-one, you can take written content and you can post that on social media, or you can use that in a flyer. If you have audio people who are skilled in audio editing, you can then turn that into a video or a 2 minute, 2-minute or a 30-second type of clip. But the idea is that, and then we will also be giving the B-roll to Courtney, so because she's super excited about video editing along that way. But the idea is giving people who work in the communication space, like Courtney, enough materials to make her job just a little bit easier and to choose from, as opposed to have to create everything. Does that help answer that question?
Oh, very much so. Thank you.
Oh, no problem.
Great answer. I appreciate it.
Sorry, I talked too long too.
No, you covered it. Thank you.
Okay, can I ask you, what is the background of these students you work with?
So yeah, these are all communication students. So they're at Kent State University. I take that back. There are 2 people who I work with right now who are in the journalism program as well. So I have students who are in journalism and mass communication. I have students who are in communication studies. I have one student who is from American Sign Language in terms of her own expertise, but they're all very interested in understanding how to craft messages, how to advocate for particular people, and how to, maybe not the legislative advocacy that Matt does, because that's a completely different level that we're talking about. But we're talking about helping shape public opinion and helping get the public to support whatever causes that we're looking at. So they are all juniors and seniors in college.
So, but it isn't necessarily focused on aging, the communication, or is it?
So the course?
Yes.
The course is focused on aging.
Oh.
We're advocating for your organization. And we have experts in aging that we are bringing into the classroom to talk about aging and issues that aging populations face.
Thank you.
JD, I like that you mentioned the difference between reporting on numbers and reporting on a well-told story. And I know for our program, we're federally funded. And I think maybe a lot of us report out, we have to report numbers. We can't always report that well-told story. So are there suggestions in speaking of data that maybe we only have a small opportunity to share a story that maybe would be more led through a number or data versus a full narrative? Are there suggestions on how we can better serve that?
Yeah, so how do we thread that needle, right, between how much time and space I have? I've talked with Courtney about this, and when this is part of our messaging plan that we had put forward for another organization with Courtney's, we used vignettes as a foundational aspect of that. So they may not have been real humans, but it's this notion of this is how we understand these people. Now, a lot of people, when they look at this, you have to understand who your audience is, right? If your audience is sympathetic, you can give them numbers, you can give them stories. But if they're hostile, you need to lead with the stories, because the stories, even if they're small, they give the chance for them to not argue, right? They're like, you can't, like, really, are you arguing with this person's story?
Right.
The other thing, in terms of just basic communication stuff that works in one-on-one communication conversations you have, this may be a slightly controversial, I apologize for this, like the best communicator that I ever saw professionally do this was Bill Clinton. And the reason that Bill Clinton was the best communicator, because everybody who talked to them, the first thing he did, aside from this thumb thing that he always did, and he had the very thoughtful, he stepped toward them. Right, that idea of moving toward the person that you're talking with makes it a little bit more personal. So if we're ever doing this in my communication stuff that I do, like I focus in on how people make sense of messages and how they respond to particular cues. And so like I can bore you to tears with this, and I'm more than happy to set up a time where you and I can talk about how to bore people about strategy, because this is literally what I do. Courtney knows this. I'm so sorry, Courtney, for this, but this is what I do.
Great, thank you. That helps. I appreciate that.
Okay, I have another question. Of these journalism students, tell me, what do you think about the future of newspapers?
As print or otherwise?
I mean, are we going to have a newspaper next month or next year? I mean, or the newspaper's history?
I think you're looking at within the 10, 15 years, newspapers are going to look very different than what they do today. I think the ideas of print newspapers are things that are moving towards not being something that we do anymore. I think that's a big problem too, because you cut out particular people from that information cycle. And there are significant ethical and I guess even societal implications for losing the newspaper. And so while I teach in our media track too, that's my thing. And so that's the part where we have to realize the newspaper is going to look very different now. And we're already seeing that in terms of the stuff that we see today. Most news content itself are very small pieces of information supplemented with a lot of tweets and a lot of social media stuff. Most news content we see today is created for an online audience, as opposed to people who are reading, the print where they could get their fingers nice and dirty. And that's something that we're going to have to come to grips with as a society.
Okay, I'll jump in here as a last call. I know we've run a little bit over, so if you do have to jump off, feel free to, but we will have to close the meeting, and I'll have the schedule for 2023 in the chat as well. But any last questions?
JD, can you put your contact information in the chat?
Yeah.
Thanks.
The best way to reach me is through email, and that is my email right here. I'm putting it down on my phone. Almost gave you my supervisor's or my director's phone line. That would have been fun. But yeah, there's my email, jponder@kent.edu, and my phone is 330-672-0182. I don't know why I hit 2 twice, but I think we can all give me the grace that I hit 2 twice. So remove that second 2 and you're good.
Thank you.
Thank you.
Thank you, Dr. Ponder. I'll turn it over to Lori.
Great information, Dr. Ponder. I love the collaboration. That's pretty cool with the students and stuff. And I'm with you. I love the vignettes and the stories as well. So I would summarize this meeting, but it would be a whole nother meeting. And I know we are up against it. I mean, phenomenal work from the group and the different counties. Everybody's moving and shaking, and we're all doing stuff proactive. It's pretty awesome. So that's my wrap up. Do I have a motion to adjourn today?
I make a motion to adjourn. This is Crystal.
Thanks, Crystal.
Welcome.
Do I have a second?
Second.
Great, thanks, Ella, appreciate it. So next meeting, Courtney, I believe we are at April 28th, correct? Cool. All right, thanks so much, Matt and Courtney, for all the great information from what's going on in Washington and beyond, and Green and beyond. And we'll see you all in April.